I'd like to just give an overview of my career as Aboriginal health worker. Working in Aboriginal Medical Services in the Northern Territory, I'm currently clinic coordinator at Wellywell and Young in Katherine. I've been a health worker for 25 years in Northern Territory. I came to Darwin from Cunnamulla in Queensland in 1975 after the cyclone for work, because that's where all the work were. The story goes, in 96 I was a cleaner at Onianini Health in Tennant Creek, and when the director Chris George asked me to become a trainee health worker, I said I'd like to think about it, and I come back to Chris and said, okay, I'll take it, I promise I won't let you down. And then I went back to Onianini as a clinic manager, and I was there for 2 months. Then I was headhunted back to Worley by Eric Thomas, who's clinic manager at that time, to be the clinic coordinator because nobody would take the job. So I've been there ever since, and that's my story of where I've worked in the NT. And I went home as a health worker, and you know what? I couldn't do nothing. I couldn't do nothing. I did the basic obs, and that was about it, you know. So, but it was a good experience for me to go and work with my mob, even though it was for a short time. My mob had said, you know, it's about time that you come home, and well, the Territory is my home. My kids are there, my grannies are there, you know, and I like it. But one thing as an Aboriginal health worker I found over the years too as well, and you know, we, especially in Aboriginal Medical Service, you know, we work in there, we're a voice, we can have a say, and be a part of that health service too as well. And that's why I like working in AMSs today, you know, if you do one little thing for your patients, whether it's filling in a form or referring them to Centrelink or whatever, or even just giving them some band-aids to do dressings with, you know, it's achieving, and I still like it today.
This morning I'm going to tell you about my story, how I became a health worker. I remember when I just turned 18, I was working at my community in Klano, and I just wanted to go out and drink and party, you know, like every other teenager. And I was like very negative about everything. But there was this lady that helped young people get full-time jobs and stuff at Klano. And she come up to me one day and she asked me if I was interested in doing a traineeship at Worley. And I didn't want to do it, I said no, but she just dragged me in the office anyway. And I was thinking, I never ever did a job interview before. I was like biting my nails, everything, couldn't even look at them. But then like 2 weeks later they called me and they said, oh, you did very well in your interview. You look so confident, but I was like really nervous. They asked me, do you still want it? I was like, yeah, okay, I'll give it a go. So when I started in Bachelor, like I really enjoyed everything, like learning, like I couldn't believe like all these diseases and everything that was out there. And I was really like very excited about my new career. So this was on the day that I got my award at Bachelor, and I won the VET Award for Outstanding Achievement for my enthusiasm and determination and positive attitude. Yeah, and in my first year, after I graduated, Worley offered me a position to work with aged care, and I loved it because like it reminded me of my grandmother, which passed away the year before I did my studies, and I just wish that I knew all that stuff that was going on with my grandmother when she was around. Like I wish I knew, wish I could have helped her the way I was helping them old people. I thought to myself, like, this is something that our families are dealing with every day. And even though I was 19 at the time, I knew this is where I wanted to be. I wanted to be a health worker, I wanted to make change. But then now I got like that respect, you know, and that trust. And all the old people and like family in Klano, they come to me all the time for help. This is one of my biggest achievements that I ever got, was when I won the Aboriginal Health Worker Award in the Northern Territory for a new practitioner. And I just wanted to say, like, being an Aboriginal health worker has given me so many opportunities that I wish like the other young people in my community could have. And I had the best senior Aboriginal health workers as mentors. It was like really deadly working with them. I learned so much. To hear it from your family, from your community, people coming up to you saying, oh, thank you for helping me. Like that, you feel so proud that they acknowledge you and they look up to you and stuff like that. Like even when I walk down the street, them young people come up, oh, you that girl from Worley, yeah, I want to be like you. Yeah, and that's like, I'm so glad that young people look up to me as a role model. And like a lot of people say that I should become a doctor, but I don't think I need to be a doctor for my people to listen to me. Today I'm still working at Worley where I started about 6 years ago. About 5 years now as a registered Aboriginal health worker, and I'm loving each and every day. Thank you for listening to my speech.